Then the formats of problem-oriented medical record. First one is SOAPIER. In SOAPIER, first one is the subjective data. S stands for subjective data. It consists of information obtained from the patient's perception and experience of problem. S stands for subjective data. It consists of information obtained from patient perception and experience of the problem. Then O stands for objective data. Objective data consists of information that is measured or observed by the use of senses. Objective data consists of information that is measured or observed by the use of senses. With the help of senses, we can observe the patient. Example, lab test, X-ray result. Then third one is A. A stands for assessment. It is the interpretation of subjective and objective data. Assessment is the interpretation derived from the subjective and objective data. Fourth one is P. P stands for plan. Plan is the plan of care according to the problem. That is plan. Next one is I. I stands for interventions. That is specific interventions performed by the caregiver. What are the specific interventions performed by the caregiver? Then E stands for evaluation. It includes clients' responses to nursing intervention and medical treatments. What are the client's response to nursing interventions and medical treatment? Then R stands for revision. If any modifications in the care plan, we can modify according to the evaluation. We can modify the plan of care. That is R. R is the revision. This is the first format of problem-oriented medical record. That is SOAPIER. Then second one is problem intervention and evaluation charting format. Problem intervention and evaluation is composed of three stages. In the first stage, problems of the patients are written in the nursing diagnosis form. All the problems of the patients are written in the nursing diagnosis form. Then second stage, nursing interventions are given. What are the nursing interventions are given? That is the intervention stage. Second stage. Then third stage is finally patient's reaction to treatment is documented. Finally, patient's reaction to the treatment, that is evaluation. It is the third stage. Finally, patient's reaction to treatment is documented. That is evaluation. This is the second format of problem-oriented medical record. Then third one is focus charting, which refers to as DAR. Focus charting is the system of documentation is client concerns and strengths the focus of care. Focus charting system of orientation. Focus charting system of documentation is client concerns and strengths the focus of care. This is referred to as DAR. D stands for data. The data reflects the assessment phase of the nursing process. Data reflects the assessment phase of the nursing process. Then A stands for action, which reflects the planning and implementation and immediate and future action. A stands for action, which reflects the planning and implementation and immediate and future action. Then R stands for response, which demonstrate the evaluation phase of nursing process and describe the client's response to nursing and medical care. R stands for response, which demonstrates evaluation phase of the first letter is the assessment phase. Then second reflects the planning and implementation phase. Then third one is the evaluation phase of nursing process and describe the client's response to nursing and medical care. These are the three types of format of problem oriented medical record. Then advantages of the problem oriented medical record: helps to organize the information regarding patient care. Problem oriented medical record helps to organize the information, can organize all the information according to the patient care. Then it is found to be effective in providing nursing care. This method is an effective method for providing nursing care. There is consistency in documentation. This method is there is a continuity in documentation. It increases continuous evaluation and revision of nursing care plan. This method helps to continuous evaluation and revision of nursing care plan. It increases efficiency in gathering data. This method increases the efficiency in gathering data. These are the advantages of problem oriented medical record. Then disadvantages of problem oriented medical record. This is a time consuming method. Training for health professionals are necessary. Trained professionals are needed. Then it is found to be difficult to implement in rapid turnover areas. Turnover area means some workers are away from the work due to some reasons. That is the turnover. It is found to be difficult to implement in rapid turnover areas. Then it results in lengthy progress notes. This is a lengthy progress note, so more time I have to spend. The third one is charting by exception. Third one is charting by exception. In this method, most methods are fall into two categories. Charting by exception fall into two categories. First one is documentation by inclusion and second one is documentation by exception. Two categories. First one is documentation by inclusion and documentation by exception. Documentation by inclusion means all the informations are documented. Documentation by exceptions are charting the exception is the documentation system to record only the abnormal or significant findings or limitations. Here charting the only abnormal or significant findings or limitations. Not all information, only the abnormal or significant findings or limitations are documented. This type of charting prevents the nursing errors, reduce repetition of documentation, save time and provide immediate identification of substantial changes in a client condition. This is the advantages of documentation by exception. This type of charting prevents the nursing errors, reduce the repetition of documentation, saves time and